Hi, my name is Jasmine Solomon. I live in Dunedin, Florida. First of all, I'm a mother. I have 3 children. I have a 15-year-old daughter, a 22-month-old son, and I just had my final child who's now 10 weeks old. I've earned an Associate's in Arts degree, an Associate's in Science and Emergency Medical Services, and a Bachelor's in Applied Science in Public Safety Administration and Emergency Management and Homeland Security. At this time, I work as a paramedic. I am also the Assistant Operations Supervisor for a company called Sunstar Paramedics. We are a part of the largest multi-jurisdictional EMS service in the entire nation. I'm also an emergency dispatcher, and I'm trained to answer 911 calls and deploy ambulances. Throughout my career, I spent a lot of time in the community in different ways. As a paramedic, I get to firsthand see the healthcare disparities and, the problems in overall health and lack of education and things like that within my community. As I've moved through my career, I've gotten to move up and see things from a higher level. And as you see things from a higher level, you get to see the problems and you get to take a step back. When you take a step back, you learn that there are bigger problems and different types of problems. So I've become more interested in public health. So I started this degree program just to learn a little bit more about how to take that interest and apply it to my career and to the people in my county. So through this course, I hope to learn how to assess the community that surrounds me and to take that big picture and say, here's my population looking at a city or my county in regards to, how many transports go into an ER or how many patients call 911 and for, different reasons. And you can take a step back and go, okay, why does this happen? Is it because of the socioeconomic status of the community? Is there a lack of education? Are we missing resources in this area? Those are all questions that are very unanswered at the level that I'm at right now. So through this course and through my education in public health, I hope to be able to take a snapshot and look at what's going on in my community and see where the biggest problems are and have actual quantitative data to look at and see that so that we can then try to figure out what the solution is to the problem and make comparisons to other places in the nation and see if there's things that we can do to improve things around us. I have a very strong interest in improving things in the community that I live in and in the workplace and trying to make things more efficient. So I think that this class is a piece to that puzzle, learning the tools and the skills of how to assess the community and trying to figure out what we can do to make a change and reassess the community, so see if those changes are working. So I look forward to learning all that throughout this class. And I also look forward to applying that to where I am right now and looking at other places and seeing what there is out there. So I look forward to learning in this course. Thank you very much.